Hi, everyone. Thank you for joining today's webinar, Technology, Transforming the Revenue Cycle as We Know It. Today's program will be presented by Domenic Segalla, Market Leader, and Kathy Ruggieri, Principal of Withum's Healthcare Advisory Team, and Dale Tuttle, Partner and Lead of Withum's Digital and Technology Transformation Team. Before we begin, I have a few notes. Today's materials can be found in the toolbar on the right of your screen. Also, at the bottom of the toolbar, you will see a chat box. Feel free to send us your questions during the presentation. We'll do our best to address them at the end. There will be 4 polling questions throughout the program. To qualify for CPE credit, you must participate in each poll. CPE certificates will be emailed to you within a few weeks. And finally, once the webinar is over, there will be a pop-up asking you to complete a survey of today's webinar. Please take a moment to complete it. It is our way of being able to provide you with the best and most relevant programs possible. With that, I'm going to turn it over to Domenic.
Thanks, Rachel, and thank you, everybody. Good afternoon. Good morning to, I saw a few people signing up from the West Coast, so 9 a.m. out there. Good morning to you. And thank you for joining us today. I'm Domenic Segalla. I lead the healthcare advisory practice here at Withum. And we're really excited to present this today on technology and the transformation of the revenue cycle as you know it. A lot has been going on during the pandemic. You know, I always say that healthcare was years behind, if not decades behind from a technology standpoint of other industry sectors. And I think it's really accelerated certain things, but we're also going to focus today on what you currently have in place to optimize that technology. And then we'll talk about the futuristic and, you know, you hear a lot of these terms, RPA and bots and machine learning and AI. And if you're like me and it's in our sector, very confusing. So Dale Tuttle, from a partner from our digital transformation side, is really going to get into what that looks like. We're actually going to show you a video on it because I think to visualize helps understand. And then we'll talk more about what the future looks like from a robotic RPA, machine learning, etc. So with that, let's get started. So again, just highlighting what we're going to discuss today. As I said, the pandemic impact, we all know there's been an impact, how that affects the revenue cycle. Kathy Ruggieri is really going to focus on current revenue cycle technology. Kathy's been in the trenches at a lot of clients over the last 9 months, either interim revenue cycle leadership roles or assessments, and really has a great understanding and will give a lot of examples of what she's seeing out there from a technology standpoint and how to optimize what you currently have in place. And then, of course, I talked about Dale's going to lead us through the real exciting part to me and the future of revenue cycle automation. So the pandemic impact, and I think this doesn't come as a surprise to anybody, but you know, the American Hospital Association came out and basically said, you know, there's going to be a huge loss in 2020. And that loss also includes $100 billion of revenue from the Provider Relief Fund. So imagine if that wasn't there. We all know that was a Band-Aid, a cash flow Band-Aid that assisted many providers, from single providers up to large academic medical centers in 2020. And then even 2021, I mean, they're projecting another $120 billion loss. So it's always important to collect every dollar, but it's more so than ever now because of the margin pressure and the issues that are taking place because of increased costs and revenues dropping. And again, of course, if you can imagine, when financial results look like that, S&P and Global Rating and Moody's came out and said, you know, we see continued fiscal woes, and that could lead to difficulty in accessing capital markets for liquidity. It could increase some of the interest rates on some of the outstanding debt that's out there. So again, a lot of impact on the financial side. So as we talked about, you know, hospital finances are in a bind. Revenues have decreased, expenses continue to rise. It leads to margin pressure. You know, we've talked and seen, and everyone's seen a lot of the statistics, but all of our clients, the volume has just not come back yet. Outpatient volume has come back to close post pre-pandemic. ED, we're seeing anywhere from 15 to 20% down. Maybe it's ticked down a little bit in some of the urban settings, but still a huge drop in volume. And the inpatient volume is still 7 to 9% down, albeit coming back slowly. And then you start to think about the ripple effect of the post-acute setting. right? When they don't have the admissions coming from the referral source is their acute side, so it has, direct correlation on the post-acute side also. And expenses. Everyone knows the nursing shortage because of either quarantining or the additional nurses needed, or because of just getting sick, unfortunately, with COVID-19. So the nursing shortage, supply and demand, has driven the cost up. It continues to drive the cost up of labor, specifically on the nursing side. And supply costs. I mean, social distancing is still taking place, the disinfectant, all of the gowns and the N95 masks. So, costs go up, and they'll continue to go up in the foreseeable future. So I just spoke about the P&L, and I just wanted to talk a little bit about the cash flow. I was talking to 3 of our clients this week, and many of you on this phone call and on this presentation probably received and took advantage of the Medicare advanced loan. It was about a year ago, and just this week, they are starting to recoup 25% of your ACH debit, or, as it used to be called, the Medicare check. So now the payback of that loan's taking place, and this clearly will have an impact on the cash flow, along with, the hits from the increased expense and the decrease in revenue. So again, the focus on collecting every dollar due, as I said previously, and I'll continue to say, always been relevant and always been of high importance, even of more importance now. I stated earlier, 2020, about 125 billion of provider relief funds was put in play as a cash flow band-aid, and it clearly helped, and it clearly allowed for continuation of services. Unfortunately, with the change in HHS leadership, there's a pause right now. We're waiting on some of the provider relief guidance, but more importantly, there was $3 billion put aside in the Consolidated Appropriations Act, 122720, under the previous President Trump, and language to release another 20 billion. We think that will take place, but unfortunately, because of this pause and the change in the leadership, we don't see, short term, defined as the next 3 months, of any help coming down the road from the provider relief funds. And, I'll reiterate it again, and I probably should have put this in bold and larger font, but it's just so absolutely critical now to collect every dollar possible. And, just from our side, we're seeing such a focus on assessments of revenue cycle processes, of workflow, of technology. There was an article, and I wish I had posted it here, where they took a poll of 75 CFOs across the country 2 years ago and said, what's the importance of doing an assessment on your revenue cycle? And 80% of them said, it's a low priority. Well, they took that same group of CFOs and did this in December of this past year, 2020, and it completely flipped. Now 80% of them want to focus on how they can optimize and assure that they're collecting every dollar out there through automation and cash flow acceleration. So again, focus on optimizing what we have now while looking to future automation and new advancements.
Okay, we're on to our first polling question. What has impacted your revenue cycle the most during the pandemic? All right, about 10 more seconds. All right, I'm going to close it out, and here are the results. Looks like about 45% of you voted remote working.
And thanks, Rachel.
And Dom, this is Dale. That's kind of interesting. Across industries, we see this as as a concern and a true impact to business operations. And a lot of times, what we see when people answer, when we dig into the remote working issue around operations and revenue cycle, and really any business operation, is your manual processes get disrupted because nobody was in the office. The simple fact of processing invoices, if you have a manual process, all those invoices were in your office for the past year and you're not, you had to make some sort of provision for dealing with people in multiple locations and paper being in one spot and you and another. So not surprised to see that at all.
Yeah, and that's a great point, Dale. And we've seen it also. It's also hard unless you have the right workflow tools to be able to track productivity, even if people are working remotely, and, in the foreseeable future, it may continue like that. So, and we'll get into that in Dale's piece, but that's even more of an importance around automation and what Kathy's going to talk about from a workflow tool standpoint. Next slide, Rachel. So this is the other thing I thought was really important too. It seems like 10 years ago we talked about this shift toward value-based contracts, and it is intensifying. That it's still a parallel track right now, but as this continues to intensify, revenue cycle operations are going to become increasingly complex. In the past, it's always been the payers are requesting more information for if you're out of network billing or if workers' comp. But with value-based contracts, clearly there's going to be a higher demand for more documentation, and having those portals and tools in place to support that is going to be very beneficial. Otherwise, clearly it's going to impact your ability to collect the cash in a timely manner. Next slide. So here's really, here's what we're thinking about and talking about and speaking to our clients, and we know. So, what are hospitals to do to offset these cost increase, the margin pressures, the cash flow deterioration? How do you collect every dollar out there that's due to you? And really it comes down to two things we're going to talk about. And Kathy's going to talk about how do you optimize what you have in place currently, because there's some great tools out there and we see it all the time. You have a tool in place, but you're only using it to about 70% of its capacity, if that. And then the other piece is, there's a lot of big institutions out there, the forward thinking, and even some of the smaller ones, companies like Olive and other companies out there that have already implemented the RPA, because as we all know, the revenue cycle, the way it was built and structured, is such a manual, repetitive process. The robotic process automation can really help and create efficiencies and create the opportunity for a cleaner claim or less denials. So all that's going to lead to a higher percentage of cash collection and acceleration of your cash collection. Next slide.
Okay, we are on to our second poll. What area of your revenue cycle do you think needs more automation? About 10 more seconds.
Yeah, and again, Dom, I'm seeing things I would typically expect, which is good.
Right.
All right, I'm going to close it out. And here are the results.
Yeah.
Looks like
that's what we expected to see. Sorry, Rich, I know I spoke over you, but it's funny. We've been in kind of a hyper computer age now in business for what, 20 years, something like this, but still manual processes are ubiquitous. They cut across a business, and this is just further proof of everything we see anecdotally, and of course in these webinars, is that there's just not enough core automation. There's just a lot of people still doing a lot of manual processes, even with the advances in computing and technology that we've seen, and especially in the last 5 years.
Yeah, that's a great point, Dale, and that's a good segue into Kathy. And Kathy, unfortunately, her camera won't be on. She's having a little Wi-Fi issues, but her sound will work, and she's really going to focus now. As I said, Kathy's really been in the trenches over the last year, really looking at how to optimize what's out there from a current technology standpoint. And based on that last poll, everyone's looking for automation, and I think the first step is use what you have to its fullest capacity, and then start to look at some of the stuff that Dale's going to talk about. So I'm going to turn it over to Kathy, and she's going to walk you through some really interesting stuff that she's seeing out there at our current clients.
Hi, everyone. So there are some key areas that we're going to cover today. The first one is going to be some discussion with regards to automated insurance eligibility and price estimation, which is very common and used, but want to just get into some disconnects that we find in some of those processes. Electronic billing has been around for, 30 plus years, but there has been some enhanced technology with some of these vendors that I think is important and timely. So we'll get into that as well. And one of my favorite areas, which is really the automated account workflow, and then we'll touch on briefly electronic statements. So jumping right into insurance eligibility and price estimation. So we all know that it's best practice to perform insurance eligibility checks prior to service whenever possible and at time of service. Fortunately, we have had access to really good tools to perform these functions for some time now. But with all technology solutions, it's imperative that the solutions integrate with solid process. In the example of the integrated insurance eligibility, your front end staff receive eligibility transactions probably real time. So if I'm a Medicare patient, you will receive back, when I give you my Medicare card, you'll receive back a transaction that my MBI or Medicare number is active, which is great. However, scrolling down to this like very lengthy transactional document of information, which is not in typically the most user-friendly format, you may see that I'm a Medicare Advantage recipient with a plan that has different requirements than traditional Medicare. Having worked with providers as recently as last week, this scrolling down of information to determine the plan specifics just may not always occur. So in this example that I just gave you, I could be registered as traditional Medicare, billed and ultimately denied as having Medicare Advantage. So that significantly delays the entire revenue process. Now I can take that even a step further, that the Medicare Advantage plan may have requirements to cover my test that traditional Medicare doesn't require. So not only has there been this delay and this disconnect of getting this denial, but it could potentially even result in non-payment altogether. So it's so important that there's that understanding of the data that's available in that transaction set back. So in summary, the technology works. However, the interpretation of the output had a disconnect, could potentially impacting the provider's ability to be paid. So take these same eligibility transactions integrated now into price transparency automation solutions. We all know there are many available to us that we're taking advantage of, and good ones. You can integrate your payers' contracts and have this behind-the-scenes programming and algorithms that you couple with the eligibility response that allows you to be in compliance with these federal regulations. Plus, you post your prices online and the machine readable format and all those requirements, and you are in compliance. But operationally, being able to be transparent at the same time explaining to your patients their expected out-of-pocket amounts based on not only the eligibility response that you get back with the benefit specifics, we know is best practice, and what our patients really expect right now. In turn, you provide the estimate from these systems and you request the patient responsibility amounts up front, albeit in perfect scenarios. Now, what these price estimation vendors will tell you is that it's really, really important to review the systems post-implementation and ongoing. Because you can do this big build and you can load all of this data and information, but is the output really what you expect? And so what they recommend is really looking and reviewing the EOBs, and you compare it to the estimate, because they're going to tell you that they get it right at implementation about 75% of the time. So these additional reviews and refinements are so essential to really bringing this functionality to best practice. Sometimes these estimates, and I've seen this, they can be an over, where you're collecting more money, which results in having to refund the patient, and sometimes having disgruntled patients that are waiting to have their money returned and refunded, or you're not collecting optimally because the build of these tools requires so much ongoing tweaking. So it's really, really important that this refinement piece is done on an ongoing basis. And it's, I think, you know, with all the other information that we can get out of our revenue cycle, where utilizing our 835s and so forth, you can really be doing a lot of process checks on this information on a go-forward basis to make sure that all of this is working optimally. So in summary, these tools are excellent, but they require our management and oversight to ensure that they are functioning and working as expected and in alignment, really ultimately with our goal of delivering really a patient positive experience, patient experience. So now we're going to move on to enhanced electronic billing. So like I said before, we've all had our EDI vendors that we've been using to bill through the clearinghouses for like 30 plus years. We have edits up front, we have customized edits, we have CMS edits to address historical claim issues and problems that we know that are inherent, that can be inherent with claims, that we can make these changes prior to billing. And all of that has been, you know, just positive improvements within the revenue cycle. But what really has surprised me, and I've seen it really several times in the past year, is the number of claims that are not submitted electronically. And I think this can be due to a number of reasons. You know, new payers that are added, they require an upfront build of adding plan codes and proper mapping of the EDI payer codes, and then in turn, education to the front end. And you could have hundreds of front-end staff, some that may be part of your patient access department, some might be in a decentralized access model. So there's just a lot of information to share, but sometimes the number of disconnects here in this area, it just has been shocking for me that there are so many payers that that do accept electronic claims but have been billed manually. I think it's really important. You know, sometimes it happens because, you know, with all of how busy we are, you know, managing the metrics in terms of electronic versus paper billing isn't always done on an ongoing basis. So like I said, you know, almost every payer at this point will accept claims electronically, but but at this point, from our perspective, these should really be one-offs at this point. Another disconnect that I've seen is the magnitude of secondary claims. So sometimes, you know, there can be disconnects with the actual spinning of the claims from Medicare, or the secondary claims that are billed manually really can go to an electronic payer, and it's just been the practice to bill these claims manually. So often there is just are claims that are being billed manually that could be looked at and implemented in a more electronic environment. So bottom line, it's just important to take a look at your metrics and confirm anything that is being billed manually is done because the payer does not accept electronic claims. And then, you know, do that periodic check, you know, on an ongoing basis, just to make sure that you're, you know, billing everything possible that you can electronically. Okay, so just moving on, also in the EDI space, in reviewing a lot of denial data this past year, there's just, as we know, there's an inordinate number that require additional information. Most are operative reports, full medical records, emergency department reports, PET scan results, MRIs, CAT scans, etc. Some payers, not all, will accept these attachments at time of bill through the electronic transmission. Work with your EDI vendor to make sure that you're optimizing all available functionality in terms of attachments. By not doing so, you're gonna, you will result in delays of payment. So just make sure you're fully utilizing the technology that is available, looks for solutions that can do that for you. One trend that I have seen pretty significantly is on the workers' comp and the no fault, there are specific vendors out there that can handle that whole process for you. And a lot of them are integrated with the EDI vendors and they have that functionality. So it just minimizes the manual workarounds and allows you to append the attachments at time of bill. Now, there are other payers that may not be able to accept electronic attachments, but do have portals to upload the documents. As soon as you submit the claim and the claim is accepted electronically, a lot of times the payers will create a receipt of, there'll be like a transmission number or a claim number attached to the claim. There is opportunity, I think, to work with your EDI vendors to accept these transactions and create workflows to automate this process. Because what's really happening now is that you're going to get in turn, you're going to submit the claim, it's not going to have the report. If you wait just for the denial, it just delays the process. It could be, I've seen as much as 150, 180 days for the entire process to run its course. So being proactive and running some functionality with your EDI vendor to be able to identify these claims and types of services will just improve your cash flow. So a couple other things real quick. Another thing that I've seen out there is the automated claim statusing, which is really excellent because it just gives you the opportunity to, so much of your staff's time can be spent on these portals, Availity, Navinet, and so forth. This just allows you to use technology to go out and get a claim status. So working with either your EDI vendor or your workflow vendor to be bringing back these transactions and populating the results within your financial system. And then lastly, in the billing area, in terms of authorizations. So authorizations, unfortunately, as much as we streamline our processes, they are inherent in the work that we do. There are just, unfortunately, some disconnects with obtaining authorizations. There is functionality now with the EDI vendors where they can actually go out to the payers and just check to see if there is an authorization on file. Sometimes doctors' offices are doing, other departments and so forth. Maybe it's a different test that's authorized or whatever it is, but at least you can have access to that data information by going and tapping into these transactions that are really happening behind the scenes. They don't require any human intervention. You can give a monthly or weekly, whatever it is, file of your authorization denials and just have these queried into the payer portals to determine whether or not an authorization exists for the patient. So bottom line, it's just another piece of the pie of the disconnects that we all encounter. And I just think it's refreshing to know that there are technology solutions to assist us. There's not this one opportunity, but I think there's a number of different things that you can be doing that can just overall improve the days to payment. Okay, automated workflow technology. So a lot of our mainframe systems have follow-up work lists for our follow-up staff and our collectors. The real question though is how intuitive and effective are these work lists? I mean, I think a lot of them will allow you to query claims or bring claims to work lists so they're followed up on a routine basis. But this is an area that's really near and dear to my heart because I think that there is some really good functionality and technology that's available out there that can really be your roadmap to process improvement. So just being able to really, you know, at a high level on a daily basis, just to see your accounts receivable on a daily basis that doesn't really require your immediate attention. You're in-house, you're unbilled, you have separate staff working on that. Claims that you've actually billed and that you're just waiting to be remitted that are within that like normal processing time, versus those accounts that you've billed that are not remitted and they're in the they're outside of the normal time frame that you would establish. So with Medicare, you expect to be paid within, you know, 14 days, give or take. So by 18 to 20 days, if you're not paid, really being able to focus on those accounts, and also those accounts that are denied and those accounts that are partially paid. So having those intuitive workflows to handle these exceptions timely by disposition type codes that are input by your staff and then analyzed and managed, in my opinion, is really best practice. And integrating these analytical tools into your workflows so that you can see where your disconnects are and how you can better manage them. I can't tell you how many revenue cycle leaders that I've spoken with when I talk to them about follow-up and productivity and all of that. They tell me, oh, you know, my staff, you know, we require them to do X number, you know, 50 or 60 or 65 plus, whatever the number is, claims per day. But my real question is, what, you know, is really the quality of those follow-ups? It's not necessarily that you're actually touching these claims and getting, you know, a check in terms of you've actually done these 50 or 60, whatever the number is. But what is the quality? What is the quality of the work? And the example that I gave before, where utilizing Navinet and Availity, if your staff are using those tools on an ongoing basis, and they're just retrieving information that's available on these websites, how much more effective would they be if you're integrating that information back and they're not performing those tasks? And so the tasks that they're really focused on and is really the harder work, the appeals, the claims where they're really trying to get the additional revenue and you know, just the additional tasks that are outside of just tapping into these other systems. So I just wanted to really talk a little bit about you know, these workflow tools and the ability to really integrate into the work that your staff is doing and actually being able to manage their productivity by task. So working, like I said before, with these disposition codes and so forth, so that you can really manage the data by collector and by reason in terms of what's occurring with the claim, and the action that they're taking, most importantly, is that advancing the account to payment and taking all that information and managing with that on a daily, weekly, monthly basis and making those refinements to your workflows that's needed. You know, I've been able to work with some of these tools recently and use some really good management tools to be able to really drill down at a collector level, even to the point of how much productivity are they getting to per hour, looking at an entire 8-hour day and looking at the number of claims that they're statusing and working each hour. Really just gives us a lot more information to better manage this staff. The other thing in terms of workflow management that I wanted to to cover today was in the area of timely filing. I mean, every piece of information that CMS, they'll periodically publish the most common denials, and timely filing is always up there. We know that Medicare, you have a 1-year timely filing limit, but there's some payers that have even stricter timely filing limits than Medicare. Being able to use your workflow integration tool and build what I would call like a timely filing matrix behind the scenes, where you can load in all of the requirements by payer. So if, Aetna has has a 6-month requirement, or Blue Cross has, a year, whatever it is, you build that in, and then you design your workflow to provide your staff work lists that prevents timely filing. So even though you're working the claims on a recurring basis, wherever they are in the workflow, even if you resubmitted it to the payer, that they show up on a work list that these are at risk. And being able to really manage in a more proactive fashion to reduce our timely filing is an opportunity for all of us within our workflow redesign. So I know I am kind of running out of time here. I just wanted to really quickly touch on e-statements. So I think that I've been involved in some implementations this past year of implementing e-statements, and e-statements is really what so many of our patients are really looking for. There are some patients that still like to pay by check and want to get a paper statement, but there's so many that want that flexibility to just have that QR code, get their phone out, scan it, and be done with it, and have no paper. So if you haven't done so already and implemented e-statements, doesn't mean that you have to move away from paper entirely. You can still utilize, some type of hybrid, where you maybe send your first statement would be an e-statement, and then send a paper statement subsequently. But I do think that there's a huge opportunity for this. A lot of the millennials and other generations are looking for, they don't want paper. So I think that there's a lot of opportunity overall just to improve our cash flow and really minimize the manual tasks that our staff is spending time on and taking advantage of the technology that's available. So I'm going to pass the baton now over to Dale for his portion.
Well, I think we have a polling question first, right?
Yep. So on to our third polling question. Which of the following are you most focused on improving? All right, about 10 more seconds. All right, I'm gonna go ahead and close it out. And it looks like 60% of you voted all of the above.
Well, it was a trick question. The correct answer was number 1, workflow. And I'm just kidding. No, again, I think this is just further evidence that people are struggling with, pretty much, top to bottom in terms of not only automating, but getting the right tools in place. So this validates what we see, and believe me, for those of you attending today, you're not alone. Everyone's got pretty much the same issue. A few businesses will be making progress, but usually one or more, maybe 1 or 2 of these areas, but not across the board. We're still early on in the modernization, if you will, of these processes and technologies and workflow automation associated with those processes. And Dom, I think you're going to kind of set us up on this, right?
I am. So thank you, Dale. Next slide, Rachel. So we're going to kick this off with on robotic process automation, and clearly this is Dale's field of expertise, and we talked about the whole manual process, but we thought it'd be important to show a little video. For me anyways, it's hard to conceptualize how this RPA works. So we actually went on YouTube. We have no affiliation with the software they're using or the company. It's a video that's out there, but we thought from a visual standpoint, we would play about 45 seconds of this video just so you can see the processes that this company, it was actually a GI, large GI practice down in Florida. And next slide, Rachel. And so just a little overview on it. You know, as a full-time employee, was manually keying about 1,700 claims per month. And so they reached out and they said, you know, how can we use RPA and automation to try to streamline this? Next slide, Rachel. And so as you can see here, they were able to automate the entire process. Clients accept going live was 4 weeks. You know, then it went from about 400 plus claims a week with 99% success. Now, clearly there's a return on investment here from you know, the amount of transactions they can go through and from the exception rate of a 0%. So we thought it'd be highly informative and from a visual standpoint. So I'm going to have Rachel play about 45 seconds of this video just so you can see, and an intro into what Dale will talk about from an RPA standpoint.
Yep. Thanks, Tom.
I also just wanted to note that this video is embedded in the PowerPoint presentation handout that you have, and we will also be sending out a recording of today's presentation as well as the handout. Just a note on that.
All right, thank you. All right, you want to advance? Oh, great. Why don't you get this polling question kicked off, Rachel, and we'll hit it from there.
All right, so here's our fourth and final polling question. What do you struggle with the most in your manual processes?
Okay, let's give folks some time to get through this last one.
All right, about 10 more seconds.
All right.
All right, I'm going to close it out. And here are the results.
Yep, again, not too surprising, but you know what's interesting here is for those of you who think it's too expensive, kudos to you, because you've probably done a few return on investment calculations already and how much it's costing you to do, you know, to operate your manual process. So we encourage everybody to do that, by the way. There are some nuances about automating using RPA that we'll talk about here briefly. And but this is good. Thank you. It gives us some context to kind of shape the discussion. Go ahead, Rach. Thank you. All right. So, you know, again, that was not we did not build that RPA process that you just saw, but we like to recognize good work and interesting work. And what RPA stands for Robotic Process Automation. Sometimes you'll hear Intelligent Process Automation. I really don't like that one because that's a beer to me. An IPA is a beer. It's not a robot doing something. But RPA represents a type of business automation. It's not for everybody, and it's actually not as scary as it sounds. While I do think robots will take over the world, you know, Skynet will happen sooner or later. This is not Skynet. Really think about this as a machine that's going to mimic a human doing something. For those of you who might still do this, because it's a very powerful tool, but maybe remember from the old days and from accounting, remember macros, right? You would get on Excel and you would just tell it to watch what I'm doing. So you put Excel into watch mode. That's what RPA tools actually are. There's a macro recorder that's going to watch a human do something. And what we do is we chunk these things up into processes, but it really is a very, very high-end and intelligent macro from the old Excel days, if you will. I'll go ahead, Rachel. So, I think we can go through this one quickly. As we saw from the polling, people are dealing with, they're doing this sort of stuff manually, and it's causing time constraints. It's error prone. Unfortunately, when people are involved in repetitive tasks, any repetitive task, there are errors. It's just, in fact, you can probably calculate a pretty good error rate if you're watching your folks as they work through these processes. But now what's happening is a robot, a machine, can now do those repetitive tasks. Go ahead, Rach. So how does this thing really work? Before you engage in any type of automation project, even if it's RPA or just kind of traditional, I hate to use that word in this context, but a standard or traditional type of process automation, you really should start out with a map. That's who's doing what and in what system are they doing it. RPA, because it's a special type of tool, it bridges the gap usually between systems that don't natively talk to one another. Because you could ask, why do I need RPA? I've heard of application programming interfaces. I've heard about all these other great ways to integrate data between systems. Why do I need a robot? Well, unfortunately, a lot of systems they're proprietary, and you'll need an API and programming skills to be able to send data, content and empirical data or quantitative data between systems. And that can take a lot of effort when really you're doing is you're just taking information from doing a search in one system, getting some sort of return from that search, and then putting it into another system, right? That's pretty much what people are doing. Sometimes there's going to be integrated workflow within those systems, but now a robot can do it. What you do is you actually chunk up the processes and let the robot take those in a sequential fashion. But to get there, the robot will watch the human do it. Okay, so you turn on the macro, the robot watches, you can log into the application, the robot records it, and we'll step by step next time do it all by itself. Now, there's a concept here called attended and unattended bots. You can leave people in the loop. In fact, I would say that's still the most common thing. The robot is not going to take over the whole thing for a couple of reasons. Usually there's lots of steps, and B, the robot's going to make mistakes too. Just like people do, the robot will make a mistake because it will encounter something that it's not prepared to handle, and then it's going to ask what to do. So that's why you keep people in the loop. But because people are in the loop, though, they can make usually pretty quick decisions, and what they're doing now is handling exceptions rather than all the foundational activities in the process. But you can just let it rip, okay? You can tell the robot, hey, just go and do what you think is best. Not a great idea usually, unless it's a very simple process, because as some of you know out there, when you tell a robot to do something poorly, it'll do a really great job at doing poorly, okay? It can process things a lot faster. It can make those mistakes a lot faster than a human can. So typically we recommend that you do an attended bot. But the tools are getting better in dealing with exceptions. Go ahead, Rachel. So why are people doing this? Okay, well, honestly, the biggest reason, what I forgot to say, I lead the data and automation practice at Withum Digital. So, but we have RPA projects ourselves, and what's motivating people? It's usually to reduce admin costs. That's usually the first thing. You're paying a person to do something repetitive that they're probably going to make a lot of errors at. And so what you do is you want to reduce those administrative costs. You want to improve the accuracy of what's happening in that data transfer from one system to the next. And you want to do it fast. And if you can reduce paperwork, and actually, let's focus on a big one, your people may be happier too, because these rote activities, most people don't like doing those things, okay? So what you'll find is that people, instead of doing all the work, what they're going to do is validate the work of the robot. That's just one idea. It might be that you could just redeploy those people to other areas. That's something I think we talk about a little bit more in a few minutes. But the idea here is you're trying to make things faster, better. I guess we used to say cheaper, faster, better. It can definitely do that. But what you want to do, though, is you really do want to calculate some return on investment, but it's kind of easy to do in these scenarios. Go ahead, Rachel. So let's look a little bit more at what can these guys do? What can these robots do? And it's really, that's what's happening fast, is that they can do more and more. And it is a little bit scary but interesting. Honestly, they're good at what they do, but remember, they're not thinking about anything. They're doing exactly what you tell them to do. So that's why, if you remember a few minutes ago, I said you really need to map out your process, because you have to give very precise instructions to the robot. The good news is you don't need to program. When you turn on the macro and the human goes and does their work, like log into an application, move files, type into one system, get results, and type into another system, or copy, if you will. What this macro is doing is writing the code to instruct the robot in what to do. Then what you do is then you tweak that process, if you will, by doing some validation runs. But robots can do a lot. As I said, they can log into an application, they move files, they can read and write information from one database to another, scrape data from the web, right? Conduct a search in the web, grab results, plop that data into another system, open up your email, read it, push it off to another place. And it can also make calculations. That's the other thing. You can actually, if there's a calculation capability of either the tool you're in, or even in some of the RPA tools now, from the data it reads, it can then calculate stuff and then spawn a different workflow based on the results of those calculations. So these things are getting smarter all the time. And but again, they're only as good as the instructions that you're giving them. And that's why we really recommend you break up your process into manageable chunks, so you can make a series of small macros for the robot to be instructed with that instruction set. So it's a lot easier to control, debug, and then have checkpoints along the way. Go ahead, Rachel. So we get this one all the time. So who's doing, what vendors are out there? And there are a lot more than this, but these are some of the bigger players. So Nintex is one. We work with these guys a lot. We're partners with them. We're partners with UiPath. Blue Prism has been out there a long time. Automation Anywhere, been out there a long time. And now, increasingly, Microsoft is getting into the game. Interesting thing about Microsoft, they rarely lead into some sort of new technology frontier. They're usually a follower. But what happens is once they decide to follow, they follow in a big way. They are investing huge amounts of time, effort, and money into automation in general, but then in RPA technology. So what they have done is that their usual MO is that they go out and then they'll buy other firms, and then they rebrand things under their own banner. So they call their RPA tool Power Automate. And this tool is like Nintex and UiPath and Blue Prism and Automation Anywhere. It is essentially it's a tool to record and automate traditionally human activities. And in the revenue cycle, we know from the polling that there's lots of manual processes that can be automated. Now, let me spend 2 seconds though about the difference between RPA and just automation. What's the difference? Most of the time on the calls that I take about RPA, my clients and prospective clients are really talking about just workflow automation. The RPA part of this is when you are moving data from one system to another, and you're creating essentially a macro for a robot to mimic human activities. Okay, so that's really the difference. Still, 90% of the workflows that you guys need are probably kind of, I would say, traditional workflow automation. But when you start talking about moving, data between systems, from one system to the other, you're almost always now talking about an RPA opportunity. So with that, that's RPA in a nutshell. We wanted to leave a little bit of time for questions. Rachel, we might have a couple out there already. But Dom, Kathy, and I are ready to answer any questions that you might have. We'll give people a second. All right, one question that I see is, all right, what tool was used in the video? That one, as I recall, Dom, was UiPath, correct?
That's correct. It was UiPath.
Yep. So again, a big vendor in the one of the early entrants in it. Solid pick if you guys are out there. You can't go wrong with any of those tools that I put up on the board. But UiPath is definitely one of the leaders and one of the early entrants in the RPA space. So let's see what else we got. All right. Kathy, I think somebody's asking if you could just quickly talk, what tools do you typically see out there? Oh, did we lose Kathy?
No, here I am. I'm here.
Sorry.
You know, we can provide maybe a list after the
Okay.
webinar, but you know, I think a lot of the discussion that I had today was really optimizing some of your current technology that you're already using and working with the vendor, with your existing vendors, to make sure that some of the best practices that we talked about today, that you're taking advantage of all those. Like so for example, on the EDI side, making sure that you are truly, you are truly billing with all of the necessary attachments that are available, that those sorts of things. So it's really kind of just making sure you're taking advantage of the existing tools.
Yeah, in fact, let me get just 20 seconds on that. It's really important. So as you're thinking about process automation, make sure you start with an inventory of your current systems. I get lots of people asking, how do we automate X, Y, and Z? What do I need to buy? And it turns out they'll have a platform already, right? I know that Kathy and Dom work with a subset, but the ones that we see all the time, people, almost everybody, a huge percentage of people are already using Office 365, for instance. There are workflow and RPA tools in the family of Microsoft 365 now that let you do the stuff that we just watched in the video. So start with the tools that you have and see if they can do what you need to get done. Great advice.
And Dale, thank you. That was a great presentation on the future of what's out there. And again, one of the things Dale noted, and we'll just leave with this is, this is not about displacing employees and FTEs. This is about putting them into a different role, creating queues to manage the process, and putting them into more important functional roles where there's higher dollars potentially. So the future is very interesting, and it's going to be great to see as this rolls out from an efficiency standpoint.
Yeah, and on a final note on that whole front, we do know that some businesses have completely outsourced this manual entry, right? A lot of times that's offshore. When you bring humans back into the loop for validation, let the robot do it, you can actually bring staff on, or right, if you can in-source this this automation, if you will, rather than rely on folks maybe offshore or somewhere else. Now, again, it may not make sense for you, but figuring out how to deploy your folks is an important part of the equation. And it's a great point, Don.
So I just want to thank you, everyone, today. Thanks, Kathy and Dale, and everyone who attended. Our contact information is here. Please reach out with any questions that you have for us, and everyone have a great rest of their day. Thank you, everybody.
Thank you. Bye now. See you.